Today we are going to deal with respiratory system symptomatology. We'll be only dealing with two things, cough and breathlessness. So you must have heard that while elaborating every complaint, we want you to describe the complaint as onset, duration, progress, aggravating and relieving factors, associated complaints, and the severity of that complaint. So that is how we expect you to describe cough and breathlessness also. In cough, the associated symptoms are breathlessness and sputum production, and everything about the quantity and the nature of sputum production. So, to see about cough, we'll look at its causes first. So, the causes of cough can be dealt with in system wise, respiratory system, um, GI, gastrointestinal system, and cardiovascular system. So while dealing with the respiratory system, we'll go from the upper respiratory tract to the lower respiratory tract. Pharyngitis, laryngitis, tracheitis. Tracheitis can be laryngitis plus tracheitis or tracheitis with bronchitis. Bronchitis, pneumonia, pleural effusion. So, how will we differentiate between all these causes? So, pharyngitis mostly is accompanied with sore throat, whereas laryngitis will have a certain hoarseness of voice. Laryngitis and tracheitis together will give you a barking cough or a brassy cough. It is a quality or the sound of cough, how it sounds like. Bronchitis will have not only cough but breathlessness also, and the patient will also perceive some wheeze. Pneumonia can be accompanied with breathlessness and chest pain. That chest pain is due to the pleuritis. The lung parenchyma is inflamed, but the pleura over it is also inflamed, thereby causing chest pain. Pleural effusion. So pleural effusion, how will you differentiate from pneumonia? So there will be chest pain due to pleuritis in that also, but because there is fluid accumulation in the pleural cavity, when the person lies down on the same side of pleural effusion, what happens? He gets relief, and that is why we ask you to ask relieving and aggravating factors. Okay, what are the GI causes of cough? You must have heard about patients of gastritis who face heartburn or regurgitation issues. The acidic material of the stomach is foreign to the esophagus, and it may come up in the upper respiratory tract, hit the vocal cords, cause inflammation over there, and cause cough. This is called as GERD induced cough, gastroesophageal reflux disease causing cough. The CVS causes, one of the important causes that you should know is pulmonary edema. The pulmonary edema presents with you with cough, breathlessness, and the sputum is pink frothy sputum. Unlike the mucoid and the sticky consistency of the respiratory tract sputum, this is a pink frothy sputum. So what happens over here? You must have heard that the pulmonary veins, they drain into the left atrium. What if the left heart is failing? When the left heart is failing, there will be stagnation of blood in the left heart, and thereby the left atrium won't be accepting more blood, and that is why there is stagnation of the blood in the pulmonary valves, and due to back pressure, stagnation of the blood in the pulmonary capillaries. It oozes out due to capillary pressure, gets accumulated in the lung parenchyma, and this fluid comes as pink frothy sputum from the patient of pulmonary edema. Okay, that was about cough. Similarly, you should ask a respiratory patient about breathlessness. So, breathlessness, you should have various causes in mind and how the breathlessness is. And that is why, while describing with onset, duration, progress, aggravating and relieving factors, we also speak about the intensity of the intensity or severity of the said chief complaint. So coming down to causes of breathlessness, breathlessness causes can be pertaining to respiratory system, pertaining to cardiovascular system, and also involving the nervous system. So how do we differentiate? Generally saying, the respiratory system, the cough is followed by breathlessness, while in the cardiovascular system, breathlessness is followed by cough. In nervous system, cough may not at all accompany, it is only breathlessness that comes. Okay. So what are the causes of breathlessness in respiratory system? Always make a habit of going from the upper respiratory tract to the lower respiratory tract. So foreign body, anywhere in the upper respiratory tract, in the nasal cavity, in the oropharynx, in the larynx, in a child where it gets stuck in the larynx or in the trachea. So foreign body in the upper respiratory tract. Bronchitis, as I told you, there is no constriction of the diameter of the bronchiole in bronchitis, and that is why the patient will suffer from breathlessness, and the associated complaint will be wheeze. Then chronic obstructive pulmonary diseases, where there is bronchitis also, and emphysema